My name is Masoud Soheilian. I am a full professor of ophthalmology at Shahid Beheshti University of Medical Sciences in Tehran, Iran, and working in Lab of Nejad Medical Center and Negah Eye Hospital in Tehran, Iran.
Tell us about the research that you presented at AAO in 2015.
Yes. Our research was about to find an association between high sensitivity C-reactive protein and AMD genotypes. And we try to see if the AMD patients shows the higher level of high sensitivity C-reactive protein in the blood or not. We did a study in this patient with the AMD, and we studied 139 patients and 123 control cases, compared this association, and we found that actually there is no difference between the cases and controls overall in terms of higher level of high sensitivity C-reactive protein. But when we go in details to the genotypes, complement factor H or Y402 genes, the CC genotypes was associated with higher levels of high-risk C-reactive protein. But in other genotypes, there was no such association.
What are the implications of that finding?
Actually, by this gene analysis, we can determine high-risk cases for development of age-related macular degeneration. There is no treatment or no helping for treatment in such cases right now, but we can determine which cases are more susceptible for development of advanced age-related macular degeneration.
So do you see this as going to be part of the standard screening protocol for stratification of patients?
Yes, in future actually, not now, because the price is too high. Genetic studies is a little bit difficult, but in future definitely we should determine which cases are more prone to development of age-related macular degeneration and advanced type of age-related macular degeneration, actually.
So what you're saying is that high sensitivity C-reactive protein, together with a particular genotype, could be a useful biomarker for early AMD or
for advanced AMD. Our study was for advanced AMD, not for early AMD.
So there was a correlation between CNV,
the CNV, geographic atrophy, yeah.
Were you able to do morphologic studies to look at these individual patients a little more closely, such as with OCT, for example?
No, actually we did. We treated many of such cases where they had CNV. But we only, in this study, we paid attention to the relation of this high sensitivity C-reactive protein with the gene. And we found it. There are several studies show there is an association with high sensitivity C-reactive protein and AMD. But some of the studies, it depends on some geographic areas. Some studies from some areas showed there is association. Some studies did not show such association. In this study, we found there is no overall association between cases and controls. But when we pay attention to the genes subtypes, the CC genotypes was associated with high risk C-reactive protein increase.
Which genotypes are we referring to?
With genotype Y402 with complement factor H.
What are your next steps for this research?
The next step actually is for seeing the other genotypes also. For example, ARMS. There are many, at least 47 genes have been found to have association with age-related macular degeneration. We only studied the Y402 and subtype genotype, but in future
Now, how do you think that C-reactive protein is interacting with these genes? Is it upregulating? Is it, what is the epigenetics of what's going on?
Well, actually, this high risk C-reactive protein, when it's elevated, it shows, that the complement factor and inflammation is increased, and it may cause, the inflammation is one of the pathogenesis for age-related macular degeneration.
So what you're saying is that in this particular genotype, the tolerance to inflammation is less.
Yes, definitely.
So tell us about some of the other research that you're doing in your department that has promise in this area.
Yeah, we are now actually studying other genes, CCL2, C3, and the combination of these genes. For example, C3 and complement factor H, Y402, the combination of C3 and CCL2, and this we are trying to see the effect of these combinations on development of advanced type of age-related macular degenerations, and also the correlation with high sensitivity C-reactive protein.
So if you were to summarize in simple layman's language, this is really targeted, the last question is targeted to patients. What are the implications of your research that patients should take away for the future?
Actually determining which cases are more prone to development of advanced cases of age-related macular degeneration, and they should actually, these high-risk cases can change their lifestyle. For example, use some antioxidant drugs more to prevent development of advanced stages of age-related macular degeneration.
Professor, thank you so much for sharing this with us. We really appreciate it.
Thank you for inviting me to have this interview.
That's perfect.